Thank you so much, Dr. Sharon, for joining us today. And today, with your help, we would like to understand menstruation and puberty with Ayurvedic perspective.
Yes, yes.
Without any delay, let's start with the first question. That is actually the basic question: how Ayurveda sees menstruation, puberty in girls, and talking about this, why the onset of menstruation is considered to be such a big milestone, especially in India, where so many cultures, so many community, this is celebrated.
Yeah. So, like I was talking about it earlier, it's about the fact that in a civilization like ours, where we understand the importance of not just procreation, but creating a healthy gene pool,
Mm-hmm.
creating a healthy female who can bear a healthy child so that we can have a healthy civilization coming forward. It was never about having children or just procreating or creating a lineage, but it was about creating a good gene pool which can enable sustenance of the species. So
Mm-hmm.
for us, fertility was important not just for that woman or for that family, but for the entire species. So fertility was always celebrated. It's not something that to be ashamed of or not speak about, because the entire town is speaking about it. Everybody is speaking because it's not something to be ashamed of. So I feel this entire the like you said, like it's taken as a celebration, is to enable that female also to speak about it more freely, to allow more women in that particular population, the community, to come forward and celebrate it with her, so that she feels more included and not left out. So I feel this is the reason why it was given so much importance. And now there's a decline because people start saying, "Oh, why do we need to make it such a big celebration?" Maybe we don't need to, but letting the community know and letting people involve in her fertility, involve in this process, makes that little girl feel included and not left out. Because recently I had a session with grade 8 to grade 10 children from a semi-urban area of Bangalore. And see, now they are just stepping into that zone where they are still yet to understand what was menstruation is, and at the same time they're stripped off of this celebration also, because people are trying to be a bit more modern about it. So what I see is that information has become very limited. These girls, when I ask them what they know, they've probably menstruated like 3 or 4 times now. And when I ask them what menstruation is, the only answer they said, their parents have oriented them, and the only thing that they said is that it's something dirty getting pushed out of your body. Changing this would have been possible if there was a community involved, with women involved in it. So I feel that probably could have been the advantage of having this whole ritual thing set in a civilization like ours, which is very ancient, very old, and respects women for what they are. I think this was the whole point of it.
I'm glad, Dr. Shannon, you pointed out, because yes, in India we are educated, we are talking about modernization, but here we lack something which is like creating a free environment, a respectful environment, a healthy environment for a girl to speak about her menstruation. So
Yes.
going ahead with this, since you have already have interactions with these young girls, but don't you feel that during this phase, these girls fear or experience a lot of fear and confusion? So how
Yes.
mothers
Yes.
can help these girls during this phase or prepare them for this phase?
So off late, it's a very recent pattern that I'm noticing, that mothers, especially mothers who are oriented to this kind of fertility related ideas, are proactively approaching doctors. So I have mothers who come to me saying that my daughter is going to attain her puberty or has just attained her puberty, and I would like to know what we could do about it. So where we sit and discuss about things that they could do to support the process, and also sometimes have an orientation with the mother and child and the father in the picture, or and then have the daughter alone come forth and we discuss about it, so that we are open. And I see that most girls today are very aware of what's happening. It's just that they need that additional support which comes out of our experience and wisdom. That's all that they need. They already know a lot of things, but it's just our responsibility to streamline it for them. So mothers should they shouldn't wait for the right time. There's never a right time. As in when you understand, like as a mother, you will know when your child is ready, be it boy or girl. So when you know your child is ready to articulate the information that you provide them, I think you should start talking about it in terms of the physical and physiological changes that take place in her system. The sexual part of it is different, but we definitely need to talk about that too, because today's adolescents are getting a lot of information from outside, and it is important that we become the primary source of information. And if you think you are limited in terms of knowledge, you definitely have people like us who can do this job for you. And I think just like marriage counseling, puberty counseling should become a routine.
Absolutely, absolutely. And not only that, so here I'm talking about urban city girls now. Uh, there was when we were youngs, and I'm sure now also in a lot of communities these things are practiced. There are like a lot of cultural restrictions during the
Yeah.
menstruation. There's a lot of restrictions. So let me ask you this question, Dr. Sharon, that are there any healthy logics behind it, or they were just the social stigmas that we were not allowed to perform so many things? For example, I belong to a community where you are not allowed to go nearby tulsi plant when you are menstruating. So, are there any logics behind it, or just we are following it?
Because I am an Ayurvedic practitioner, and because I am deeply trying to understand the scriptures and their valid and their relevance in our lives, I feel I'm able to look at it with a very rational and open mindset. So without any restrictions, when I'm able to observe these rules and regulations that they put forth, like for instance, Ayurveda says wake up at between 4 to 6, that Brahma Muhurta time, you wake up. Now, if you try to like impose it on a person, it might feel like an illogical thing. But when you start looking at it with a open, rational, scientific perspective, it makes a lot of sense to wake up at that time. But definitely, we need to also try to modify it to suit the patient's requirement. Similarly, the rules laid here, Ayurveda has set of certain rules that any menstruating woman needs to follow. But apart from that, communities have their own ways of dealing with things depending on the place that they are, practices they have. So if it is implemented with its real purpose, then it definitely makes sense. But when it is now since a very long time, it's about imposing things on the woman. It's like kind of a little fun to impose and tell her what she should and shouldn't be doing, which is where women get irritated. So I think the whole idea is to modify it to help her accept it, to suit her health. So certain, like you said, watering a plant or tulsi plant for or any plant. Not this orientation that I did for the children. She also came and asked me. I love gardening, but my mother doesn't allow me to pour water in the garden, and she says the plants will wither off. Is it true? So is it true? See, the whole point was any activity which was mandatory for the girl was restricted at that time, because you don't have to do it just like that. Like for instance, I am a Christian, I have to go to church on Sunday. It's like mandatory. If I go to my in-laws place, it's become very mandatory to do that. But if it's my period, I would like to sit back and relax. So just to give the favorable advantage to that woman, they said, see, these days you don't have to go. So that people say that, okay, fine, they let her be by herself. Now, if she wants to go or not go, that's something that we can build to suit her requirement, but it's about giving her the option to relax. Like for instance, I'm just like we're having casual conversations, so I'm telling you, Karnataka government taking off the menstrual leave policy. So they
Yes.
gave a menstrual leave policy and they took it back. What the judge said was, if I make it a law that a woman should take one day off, what if she doesn't want to take an off? So you cannot impose things on a woman. Instead, you can orient her and let her understand, and then just not let her make a choice to do it. But then there are certain things like in temples, for instance, I still feel there's a lot of energy in temples. I feel it personally. So there is an energy because that space is built for that. Too many people come there. And I feel that a woman entering a temple at that time may be a little, it's like if you believe in energy exchanges and all, she herself is a source of energy at that point, with energy moving in downward direction, apanavata in downward direction, and temples are space where pranavata needs to be very high. So there might be a mismatch there. So as a result, restricting her would be good for her. She could rather use that energy to heal. So like
Absolutely.
that, you have certain rules and restrictions, which if you look at it in a very inclusive manner, it can help the woman. But if you put it as an imposing thing, it's going to come up with a lot of repercussions, which is what's happening.
So I think these practices were like kind of a leisure time given to female to
Yes, yes,
relax. But over the period of time, we have conditioned ourselves that these are restrictions.
yes.
Um, so, but okay. So what happens is you've correctly put that imposing things. So since a lot of people don't know why we are even practicing it logically, but it's just that they are following it, and that's why we have to follow it. And that asking why makes it so rebellious that someone might not follow it just for the
Yeah,
sake of that our
yeah.
why is not answered. But already that young girl is going so much of transition because there is mental transition also, there's physical transition also. So tell me here, Dr. Sharon, what about irritability, mood swings during this point of time? How Ayurveda sees it?
See, okay, this irritability and mood swing part of it is something which generally happens when there is a very low level of progesterone in the system. So when your hormones which are responsible for feeling good, like the feel good hormones, dopamine, endorphin, serotonin, oxytocin, and all these feel good hormones, when they're low, this happens. So the whole point of Ayurveda is to make sure that all of these hormones are balanced so that she doesn't have a dip very often. So if you look at it, women who follow a good lifestyle aligned with Ayurvedic principles, they don't feel or experience these dips very often in comparison to women who don't do that. So it's like normalizing or saying that it's okay to have so many mood swings is also kind of setting a very negative pattern because you're stripping her of the ability to feel better. When you say pain is okay, then she keeps feeling the pain and she keeps saying it's okay. But it's not. You keep saying it's okay to have these mood swings. You can have it like for a day or two, but if an abnormality or a discomfort is extending beyond a certain period, it's never normal. Normalizing it for a woman I feel it reduces her opportunities to get treated or feel better. Like, for instance, we did a very simple uh, study on a group of 100 women to understand how Rutucharya, that is following Rajaswala Paricharya, or Rajaswala Paricharya is following the rituals or regimens mentioned in Ayurveda for a menstruating girl.
Mhm.
So when we didn't give any medications, we only followed the diet and lifestyle. And we did it for 100 girls who are experiencing PMS and dysmenorrhea, painful periods. And we did it for 3 months. No medications, only the processes like a regulated diet, rest, relaxation, not putting her under too much stress. We regulated that process. When we did that at the end of 3 months, we had a study which showed significant improvement. Like statistic wise, if you look at it, I mean, if you see single patient to patient, I feel all of them have improvement. But to show the world, we need to show it statistically. So when we showed it statistically, there was a significant improvement in their symptoms of PMS and dysmenorrhea. All of this without medication, with only lifestyle. So this is the kind of process that we've set for women, which allows them to energize themselves while they enter into this phase. And it is not about one cycle alone, it's about every cycle because progesterone values in the body keep going up and down, and it's important that we keep the pool healthy.
Mhm.
The pool of hormones should be healthy so she can take it up from there as and when she needs. If you're going to reduce that opportunity for the woman, then as time passes by, nothing gets better for
Yes.
sure. Yeah. So this whole mood swings and up and down is normal because of the drop and rise of hormones. But at the same time, it can be better.
Mhm.
So every woman should be given that chance to feel better.
So, since Doctor, you were talking about diet and lifestyle and how mood swings or be it painful periods, tell me one thing about that. Does this mental stress has also a reason behind all these problems? Mental stress can also be a reason
Yes,
behind all these things.
definitely.
And
Definitely.
adding to it, young girls following this watching blue screen for a longer period of time, does that also have an effect on it?
Yeah, because see, it's very important for everybody to understand this that the reproductive system and the hormones are not independent of other systems. They are not
Yes.
independent. It is not a organ by organ, system by system functioning ever at all anywhere. Especially so here because these hormones, the estrogen, progesterone, which people understand as female sex hormones, are not just restricted to female sexual functions only. They are expanding their functions because they are hormones. Hormones can go anywhere, wherever there are receptors, and these hormones perform their function at the level of your nail, bones, muscles, nutrient absorption also, and it's
Mm-hmm.
definitely going to have an impact everywhere. So it's vice versa too. So if a blue screen is going to impact your mood on the basis of dopamine and other hormones, it's definitely going to impact your sex hormones, just like how your sex hormones can impact them. So stress in women has to be handled differently. I've already done a video on that as to how stress in women has to be understood differently because there are different species with different kind of hormonal functions. They need a different way of regulating this. So female adolescents, when they enter into this kind of modernized life where there is too much of screen exposure, allowing women to take too much of stress, like for instance, young girls, for instance, 13, 14-year-olds, they sit up late in the night studying.
Yeah.
So that practice itself is a very strong practice. And what we do is when we try to minimize that time, when we keep a cutoff time at 10 p.m. and allow them to wake up at 3 or 4 a.m. in the morning to study, I see that most of them start having more regular cycles in comparison with those who don't do that. So this,
Mm-hmm.
and also too much of stress in terms of not allowing them to even have the time to go for a walk or a cycle or a badminton class. That attitude also I try to change in the parents, which I think most of the doctors my kind are doing already. And I feel that itself regulates a lot. So it's about doing or weighing your priorities and implementing them because there is no pain, no gain. So if you don't really do what is required for your sexual health, reproductive wellness, your daughter is going to suffer, or the person who's menstruating is going to suffer later in life, which we're seeing now, early menopause, premature menopause. And even if they're 35, they already start experiencing symptoms that like women who 50 used to experience. This is all a cumulative result. It never happens overnight.
So, doctor, when you were saying that the bad jobs at this point of time can reflect later in life in terms of fertility, so can you tell us some of the warning signs what females should be or mothers should be taking care of or should know about their daughter's menstrual cycle so that they stay aware about it and they reach out to the doctors?
Yeah. So when it comes to adolescents, when they start bleeding, first is that one, most of them are very young right now, though they know a lot of things, still don't know how to handle themselves when this happens. So normalizing the sanitary, whatever is that you use, normalizing carrying it with them, teaching them how to maintain menstrual hygiene is very important because that seems like a very negligible thing. You think the child will know how to do it, but most of the children still feel hesitant to go to the washroom, carrying their pad or tampon and changing it there. So it's important to orient them. It's important to bring the class teacher also into picture. And I feel most schools are doing that now. It's important to do that. One. Second is that pain can be normal, but it has to be a tolerable pain in terms of that girl, not what is tolerable to you. So if you have had painful periods and if your daughter is developing periods pain with such intensity, it's something that you need to seek help for. And then heavy bleeding or prolonged bleeding. That is also common during this phase because of more chances of anovulatory bleeding. So these bleedings are generally not ovulatory in nature because the system is still getting into motion. It's unlikely to have an ovulatory period. So they tend to have long cycles, heavy cycles, prolonged ones where there is going to be nutrition deficits also. Our iron levels are going to drop, general body strength is going to drop. So it is important to reach out for these conditions. Some patients I've seen that they let it go because some people say it's okay to have prolonged bleeding. So it's important to seek help and supplement her sufficiently so that she doesn't land up in severe anemia later, and then you need to go for all the admitting, treating. That becomes traumatic for the child also. So instead,
Absolutely.
proactively take action. And then another thing is more gap between each cycle. So that also happens in adolescent anovulatory bleeds. So this is also common. So if you seek help, you will understand why this is happening. It can happen because of hormonal dysfunction. It can also happen because of nutrient deficiencies. So your doctor will know how to help you with that process. So it is important to seek help there instead
So
of waiting for
here,
it to get worse.
so here, doctor, you were talking about diet. So let us ask you that what can be the food options which we can give to these girls, which help them in regulating their menstrual cycle first, and also balancing their hormones.
Food options, I would say, actually, I always ask every person, every woman who asks me for support for their puberty, menarche girl, that what goes on in your culture? Like, I've seen a lot of, heard a lot of inputs there. Some of them talk about giving ragi as the meal during that time. Some of them talk about giving til laddus at that time. Some of them also talk about giving eggs, raw eggs to the
Oh,
child. Some of them have spoken about making something called ulund kali, which is ulund is a urad dal. They prepare like a kali, like a ragi ball like thing out of it, and they feed the child that. In some places, horse gram is also given. So, like this, each of the places have their own practices, and it would be nice to consider that practice. And, like, for instance, raw eggs, I really don't recommend now because we don't know the quality of the egg, we don't know the child would like to have it. So, all that is maybe you can modify it, but giving ragi is a great option. Giving til is a great option. Adding more ghee and jaggery is a great option. So these options try to make sure that the girl is having nutrient dense food which supports her the process, which helps her handle the pain, which also helps in the lower movement. Like if you see all these things like sesame, til, laddu, ghee and jaggery, all these things help in the panavayu downward direction if you look at the property of the food itself. So all these things will help her focus, help her energy move downwards. So they don't, things that don't create urdhvagata, upper movement of vayu. You can understand it as burps if you want to. Any kind of food that's going to be heavy on the stomach, creating upward movement may be restricted. Anything that promotes downward movement can be allowed. And it is important that you sit along with your parents or try to make an account of what they have done, document it for your child and discuss it with your doctor and then implement it for them. Ayurveda recommends having very light food, khichdi like meals with rice and dal and with tadka and with probably some cooked vegetables in small portions to the how much that girl can eat. This is Ayurveda's simple recommendation. It doesn't go and give you a list of what you could eat in this period. It's about using your rational and common sense because there are a lot of different practices. So it's about being inclusive at the same time. So yeah, it's about using the right kind of diet.
so, Doctor, you have spoken a lot about diet, and I'm grateful that today the mothers who are watching it or maybe watching it later will take away because the food which you have spoken is somewhere included in all the cultures, north
Mm.
to south, east to west, irrespective, and that's kind of a universal food. But here I have a question. What about the trending food, the processed food or the sugary drinks? What about that? Kids are more attractive to that rather
You
than.
tell me, Shivani, what about that? You think children should take that?
I think coming out from a doctor will be more authentic and
No,
credible.
you know it's not advice, right? You know it's not good for her, right? It's as simple as that. There is no scope for any further argument on this at all because sugar, direct sugar, refined sugar, like what we see right now, which is present in every single junk food and processed food that we see, either in a visible or an invisible form. They either disguise it in some form or it's directly put as sugar. All these things add to inflammation. All these things add to inflammation. She might feel suddenly energetic, but at the same time, there is formation of prostaglandins, which are the hormones which is inflammatory regulators, and they are the ones that create pain. So why even indulge in something like that?
Absolutely. So a very strong statement. No to the
See,
packaged food.
on this note, I would like to talk about this. I really wanted to talk about this because this
Please go
whole
ahead.
idea of having chocolates and cakes before your menstruation during your PMS, people making it normal to gift their girlfriend one whole bar of Dairy Milk Silk. I mean, that's chocolate. Yes. If you want to, you have 98, 99% dark chocolate because that's chocolate. It will calm your mood, improve your, your keep your cortisol levels in check. But sugary chocolates, silk, dairy milk silk, that's loaded with sugar. It's not going to help you in any way. Instead, go for whole foods which are rich in sugar. Like rice is a whole food which has sugar. Fruits are whole foods which have sugar. Process it in such a way that the girl can digest it and give it. That's also sugar, but healthy sugar. And anything else is absurd.
This is so true, and in fact we know the side effects of it, but still controlling ourselves is so difficult. But yes, doctor, it is very black and white about what is good and what is not here in
The
this case.
control again is a practice.
Sorry.
Control is also a practice. If the mother takes control and teaches
Yes.
the daughter, most I've seen mothers who are healthy, who eat healthy, who practice healthy, their daughters also do the same thing. It's like it's a given. It's a given. So if you have trained your children to eat healthy, it's most likely that they will eat healthy 9 out of 10 times. But if you normalize this, most likely that they will also normalize it 9 out of 10. It's not their fault.
So young mothers, that today's lesson, you are not taking away for your daughters, but you are taking away for yourself. Set a good example so that girl starts following it, isn't it, doctor?
Definitely, definitely.
So
Everything starts at home.
yes, absolutely. And isn't it? Or everything is based on epigenetics, and this is one of it.
True.
So, so doctor, now talking about, since you have spoken about menstrual hygiene, so there are so many tampons, menstrual cups, sanitary napkins. What you will suggest for young girls, or be it in general also, what should be the right kind of material that should be used?
No. See, this is a question of, again, we have to process what is good for you and what is good at the moment, what is good for the environment as well.
Yes.
So if you, I people do ask me this question. So pads, of course, they absorb things outside the body, always safe. But today, pads and diapers are contributing to maximum garbage load that we see. So I would think about if I love my environment, which I should, because that's where I live and everybody lives, I should be considerate about the pads that I use because the pad industry is also booming. Whisper is making more than 200 million crores. I don't know. Somebody was telling me recently of sales in India alone. And and what about the garbage management, the waste disposal? We really don't talk about it. So pads which period panties which are washable, reusable may be a great idea if you want to use pads. Otherwise, now we see the entry of cups. So people can consider using menstrual cups. If you look at the pros and the cons, most of them who are using cups always say that they feel extremely comfortable in them. So yes, cups are a great idea. This is a great idea to minimize your menstrual garbage also that you are sending out to the environment because we've still not learned how to process that waste. So, or probably come up with an idea to process that waste properly because most of these pads and all contain, especially I would say restrict these pads which have gels, fragrances in them. Fragrance especially, if it says additional fragrance, just don't invest in them at all these fragrances are carcinogenic and will promote cancer. So any fragrance based pads should be discarded, and pads which contain gels also are sources of damage, so it can be restricted. Cotton pads are great, but again, if you want to think about the environment, which I think all of us should, because
Yes.
it's our responsibility, then yeah, that may again not be a great idea. So cups at the moment seem like a more sensible or a period washable and reusable
Panties.
period panties.
Yes. So now, doctor, uh, we have spoken about the hygiene diet, but what about activity? There are so many girls who are into sports, or there are young girls who are into intense workouts during this point of time. So does Ayurveda allows, or how Ayurveda sees intense workout during this period?
Anything intense, be whether she is menstruating or not, any intense activity is vata increasing in nature. Ayurveda understands it that way, that it's going to, any movement is going to create a lot of subtle movements inside the system, activates a lot of, which is why fat burning and all of this happens when we are in intense movement. So all of this is vata generating in nature. So if you're going to engage in a vata generating activity during your period, it is definitely going to affect your period also in terms of painful periods or in terms of uh, irregular bleeding later. So if it's an occasional activity that you're indulging in once in a while, it's okay. It's probably, if for instance they have a sports day and a running competition, the girl wants to participate in it. If it's once, you can probably give her a little more source of quick energy, like a yavagu, like a sattu mix, like dry fruit laddus, and send her off there and then replenish her with ORS and then manage it. But athletes, girls who are into constant practices like these, I am part of a bikers group, so I see that girls there who bike for long distances during their periods, they want to know what they want to have to do. So it's for all of you athlete girls who want to do all these things. Make sure that you during your periods, your activity is considerably minimal when compared to a regular day. Try to tone down, try to bring it down, the intensity of the activity at least. So it's just a matter of 2 or 3 days. If you can restrict yourself, minimize your activity, to be great. And if you are an athlete who also functions during their periods, make sure that before and after your period, you do practice Abhyanga every day. Abhyanga is a ritual of applying oil on your body, on your head, on your ears, feet. So engage in this practice every single day before and after your cycle as a routine. So it helps to calm the vata down. So as the vata calms down on a regular basis, you can function better here. So like I said before, no pain, no gain. So if you really want to do all this during your period, you have to really put a little effort before and after your period to make sure that your period time is not compromised. So if you want to do it, do it. Do it. Like, I don't really want to tell girls, stop doing what you're doing because you have a period. Not the best way to do it. So if they are in a way they have to practice at that time, they have to try to bring it down. And the rest of the days, practice Abhyanga. Do not stay up at nights. Do not engage in activities that would otherwise increase vata. Preserve your energy so that you can function during your periods as well.
That's a very nice answer, doctor. That giving wings to girls and making sure how to manage it. Um, but okay, so there's somebody in our audience who have asked this question, and we go back to the same question that when you talk about sanitary napkins, when we were talking about sanitary napkins, you talk about menstrual cups. So here, I'm sure there's a mother in our group who's asking this question that what about 14, 15 years old
Yes, I
girls?
saw
We
that.
can't.
Yeah. You can,
So
you can. Menstrual cups can be used in any girl. There is no age restriction to that. We have small cups, medium-sized cups, large cups. Small cups are exclusively meant for children. And it is, you just have to teach them how to use it. And you have to teach them how to sterilize it and dispose it. It's easy to use provided they get a little accustomed to it. So probably you can use it the first time when she's at home, train her how to remove, wash, sanitize it herself. It's, I think there are girls who do that. See absolutely no problems in them. Again, see, there is a question of pad or cup. So that's a very personal choice, which is I given both options, washable period panties and this. So I'm not trying to impose anything on anybody because people just get, when you see cups, they are a little scared. But you don't have to be, is what I'm saying, based on the literature that we have. You don't have to be scared about it, but it's a personal choice. Not everybody is comfortable with cups, it's a personal choice. But if you're asking me, can a 14, 15-year-old use cups? Yes, they can.
Thank you so much, Doctor. Doctor, since we have spoken about so many things, now the most important thing is fertility. So today's adolescents who are into their menstruation, what hygienic practices or what healthy practices they can do for the so that they maintain the fertility later in life. So what will be your tips on that?
My one single tip is treat every menstrual cycle as something important. People start paying attention to their cycles only when they want to get pregnant, which is too late. So if you want to have a good reproductive phase, have a healthy pregnancy, that's one thing. If you don't want to get pregnant also, if you want to have a healthy perimenopause and postmenopause, if you're looking at aging gracefully, every period becomes important. So no single period is a time when you can casually let it pass. So when I say that, it should become a practice naturally to respect your period, to give the necessary attention that you need to your body during your period. Be mindful. Just like every meal, you should be mindful. Every night when you go to bed, you should be mindful. Same way, once in a month when you get your period, be mindful. Be mindful of the changes that your body is showing to you. If you are tired, respect it. If you're feeling exhausted, don't bring down your work and attend to it and see if it is repeating again the next time. When you start paying attention to every cycle, you really know what's happening in your body. And when you do that, you are maintaining your hormone pools, you're making sure the HPO axis is aligned, and you nothing is a matter of chance after that. Everything is planned and calculated. By chance, it doesn't happen that one day you start bleeding heavily. You know what happened. You know, there are people who tell me I traveled a lot the past 2 weeks. I know, or my father passed away 6 months ago. I didn't get my cycle. They know because they're mindful of it. So nothing happens overnight, especially in hormones. Nothing happens overnight. So you know why it has happened. Being mindful is the first step. Protecting your cycle, taking protecting in the sense being mindful, protecting your own body. Every cycle can definitely help you age gracefully, which is the ultimate goal. Maintain fertility, which is also a goal, which is also executed.
Very well said and very well put together all of this thing. And I'm sure for mothers, it goes away a lot of messages, a strong message. And you have already mentioned it during the conversation that first they have to start all the good things on themselves, be a
Mhm.
good example for their young daughters,
Yes,
and
yes,
then preach it.
yes.
So, but I wouldn't allow you to leave this conversation, doctor, until you give tip for mothers so that they become more aware about their daughter's menstrual cycle. What tip you would like to give it to them? One tip.
One tip is that if you have had a problem during your puberty, adolescence, or your cycles now, and if your daughter is reflecting a similar issue, do not ignore and say it will go away after marriage, it will go away after a child. Do not say that. And if she's still not showing any symptoms, but you've had it, you've suffered with it, your mother suffered with it, your sister suffered with it, understand that this has a genetic pattern of carrying forward. So this pattern may reflect in your daughter at some point. Be proactively involved so that she doesn't suffer the way you suffered. Most endometriosis cases I've seen this, that they come to me with endometriosis diagnosis, which they've been suffering for a long time because endometriosis diagnosis in contemporary age takes a lot of time till it shows in the ultrasound. But we start identifying these symptoms very early because painful periods with a certain pattern is something that we are trained to look out for. We identify it, but most people they come to us after knowing that endometriosis has no treatment outside. Then they come to us. In such cases, the interesting part is that they know that their mother also had a similar issue. They know that their mother's sisters also had similar issue. And still, I feel if the mother had watched out for the daughter and her painful periods and ensured that when she was 15, 16, they did something about it, probably we could have prevented the expression of this particular condition at this age. Because when we proactively take steps, diet, lifestyle, and Ayurvedic medications, including processes, many multiple procedures that we have for the woman, proper orientation with an Ayurvedic doctor, with an Ayurvedic person expert, then what you do is that you get the child who understands this possibility and grows to live a healthy life.
Oh,
Why
that's
deprive her of that? This is something that I feel all mothers should know and proactively take steps.
so. To all the mothers, we have already given a strong message out there that Ayurveda is there to take care about your young girls. It's just that you have to reach out to the right Vaidya. We have Dr. Sharon Samuel on Hello My Yoga always. You can always reach out to her. We'll make sure that in the caption we'll mention about her handle details so that anytime young mothers who are watching this, who have young girls who will be soon starting with menstruation or who are in that phase or who have got troubling menstruation, they can always reach out to Dr. Sharon Samuel. Thank you so much. Thank you,
Yeah,
doctor, for joining
thank
us.
you, Shivani, for picking this topic. It's a very interesting topic, but very less spoken about because I don't know, nobody cares about adolescent girls. I don't know. It's always about studies and exams, but it never comes to this. So thank you for picking up this topic. This is exactly where you can groom healthy women, become healthy now, later. So thank you for picking this topic.
Thank you so much, Doctor, and thank you so much supporting us and supporting the community. We always look forward to you and your support.
Thank you. Thank you.